Hello and welcome to another edition of the Lynn Lowdown. And today we have a special guest with us. It's Audrey Gasteier, and I'm sure I said it right because you made sure I said it correctly. How are you doing today?
I'm doing great. Thanks so much for having me on.
Okay, thank you for coming on to discuss such an important topic regarding health insurance. You know, with the recent COVID layoffs, there's been so much happening just in the world, and also there's some information that people need to know about health insurance and the open enrollment that started on November 1st, and it goes on till January.
That's right. It goes till January 23rd.
January 23rd. Okay, so let's talk about this and some of the changes that's occurred due to COVID.
Absolutely. So right now is the Health Connector's open enrollment period. And this is the time every year when anybody can come into the Health Connector and get covered with health coverage. So it starts on November 1st and it runs through January 23rd. So this is the time of year we're out there, we're across the state. Obviously, COVID's made that a little more challenging in terms of in-person outreach and engagement, but we want to be really drawing people's attention across the whole state to how important it is for people to have health coverage. Health coverage is obviously always very, very important, but with the ongoing COVID pandemic, of course, there's never been a more vital time for people and their families to have health coverage. That way they know they can get tested. If they have COVID, they can get treated, and they get all the health and financial security that comes with having health coverage. So this open enrollment period is particularly important for people to know about and know how easy it is to get into health coverage, and that in Massachusetts, we have a lot of special supports for people to be able to actually afford that health insurance.
Yeah, because not only with having this affordable health insurance is so important, because people, the testing, people can go to certain sites and get it for free, but then when they do get it, they have to be taken to the emergency room. And some people are spending longer periods of time in the hospital in ICU. So, and some people may not have health insurance and they have to be rushed to the ER room. And when they're out, they get hit with a bill that, some take forever to pay. So just for people to know that Massachusetts is still one of the states that best suited to provide health insurance for people.
That's exactly right. And Massachusetts for a long time has really prioritized healthcare access for all of our residents. But we know even before COVID hit, and we all know about all the disparities in terms of different communities and populations that COVID is hitting harder. But even before COVID, we know that there's cities in the Commonwealth, there's populations in the Commonwealth that aren't as likely to have health coverage. And we need to do more as a state to be making sure we're enrolling people, we're letting them know how to do it. Exactly like you said, the last thing we want people worrying about right now is if they get sick, how they're going to pay for it. People should be worrying about their health right now, taking care of their families. Health insurance should be the last thing on your mind. So that's why it's so important to get covered. And Massachusetts, you're right, we have some of the best healthcare facilities in the world, and we want to make sure everybody who lives in the Commonwealth of Massachusetts has access to those great services, particularly thinking about COVID, but all the other different kinds of health conditions that anybody could have or develop at any point. And we don't want people worrying about how they pay for it or how they access it, and that's what health coverage is all about. So it's one of the things we find is especially important in Massachusetts, and we try to talk a lot about during open enrollment, is Massachusetts has a special program for people called Connector Care.
Yeah.
So when people come to the Health Connector, they can go on our website, they can visit with a navigator, we'll talk about those in a second, and they can find out if they're eligible for financial assistance paying for health care. When you apply through us and you apply for financial assistance to see if you get it, you might qualify for our state's Medicaid program, Mass Health, or you may qualify for this special program called Connector Care. And just to give people a sense of kind of who might qualify for that, an individual or a household of one that earns up to about $38,000 a year, or a family of four that earns up to about $78,000 a year can qualify for this program if they don't already have health insurance through, for example, an employer. And this program makes health coverage very, very low cost for people. Sometimes there's no premium associated with it, or if there is a premium, it's very modest. And not only that, in terms of the premium side, but there's no deductibles. The cost sharing is really low. If there's any copays, they're very low for prescription drugs or visiting a doctor. And that program's not available in other states. This is a special program that Massachusetts makes available to people with up to moderate incomes here in Massachusetts. And when we talk to people who are uninsured, sometimes they say, well, I can't afford it. But once they actually see the information and how many people qualify for it and how affordable it is, it changes the whole equation for them.
Now, can you tell me the demographic or the age range that you all have received for these applications? Can you tell me that? Because I know as we talk COVID, it has affected many elderly people. So how many? Can you just talk about the demographic that's been coming to you all to fill out the application?
Yeah, so at any given point, the connector right now, for example, we usually have between like 285,000 or 300,000 people that we cover. And some of those people are covered with us for years. Sometimes people come to us for a little while between jobs or between different life circumstances. And we really cover people, we have, some kids on our program, but for the most part, it's adults between like 18 and their mid 60s. And during open enrollment, we do a lot of work to try to reach younger people who tend to be less likely to be insured than their older counterparts. And it's really important for young people to have health coverage for all different kinds of reasons. Even though young people often feel invincible, they're not sick, they don't have any particular healthcare needs, so they think, you know what, I'll wait, I don't need to worry about it. But obviously, as we know, and COVID has brought this into focus for everybody, anything can happen at any given point. And the last thing you want to be dealing with is worrying about how you're going to pay your medical bills or medical debt or anything like that. So we tend to do a lot of work during open enrollment and around the rest of the year to really make sure we're reaching youth demographics, because that tends to be the population that's most likely to sit out of coverage. So for this open enrollment so far, it's still kind of early to see who's coming to us just yet, but we're seeing kind of across the board in terms of the age range, and we expect to see that going forward too.
Yeah, it's very important that people sign up. And from reading the guideline that Lisa sent me, it showed that Lynn, let me bring this up correctly, Lynn, 6.1% of residents in Lynn don't have health insurance. So I'm sure some of these areas like Lynn, with such a diverse community, I'm sure you guys are encouraging people in these type of communities to sign up, because 6.1% people not having health insurance, and family histories of illness and just health issues in areas like this, it's a vital role in the longevity of how long people live. So it's very important for people in Lynn and areas like Lynn to sign up for this.
That's exactly right. So one of the things we've thought a lot about at the Health Connector is we're very fortunate in Massachusetts. We actually have the highest level of insurance coverage in the whole country. We have about 97% of our residents, in total in the aggregate covered. But then we look at these particular cities around the state, and sometimes it's 5, 6, 7, 8% rate of uninsurance. And so that's on us to try to help work with these communities to make sure people are getting into coverage. That's not fair. We've said as a state, we want everybody to have health coverage. We've made these investments politically, financially, to create these programs to make sure people have health coverage. And if that is not something that's coming true for all the people who live in all the communities around the Commonwealth, that's a huge problem. So we want to make sure that communities like Lynn, that we're getting the word out to people about how affordable and easy to enroll it is in health coverage. It's going to meet all of your needs, all of your family's needs. And that's one of the reasons that we work with local organizations we call navigators, where we provide training and funding to local organizations around the state that can work directly with their communities to provide assistance to people that might need help filling out an application, might have questions about which health coverage option is best for them, any questions people have about how to get across the line getting covered. And so we have a navigator in Lynn with the Lynn Community Health Center. People can come to our website, which is mahealthconnector.org, and go up to a link, a little place to click that says Get Help. And you can find a navigator in your area. You can find an enrollment assister in your area. Obviously, COVID has made things more challenging in terms of direct in-person assistance. Normally we have, big enrollment events and in-person events for people to help get them covered and raise awareness. This open enrollment, there's more going on over the phone and with virtual visits, but even for people who want to do some in-person assistance, some of our navigators are doing that in COVID-safe ways. So we encourage people to check out our website, find a navigator, find an assister near them. But the website itself is worth coming right to, mahealthconnector.org. People can fill out an application. They can find out if they qualify for financial assistance. Most people do. Most of our enrollment, people are qualifying for these subsidies. They're qualifying for Connector Care. So they're getting into coverage that's very low cost to get into and to use.
You talk about you just talked about some the events the open enrollment events that you've had throughout the years. And I think I remember when last year you guys came to the health center. I think there was a big event and you sent out a bunch of individuals out in the community to talk to people, to inform them and let them know. Is that kind of disheartening that you weren't able to do that this year because the event is such an important event and people actually do sign up?
Yeah.
From this
Absolutely.
event.
Absolutely. We're so disappointed to not be able to do the same kind of in-person work that we normally do during open enrollment. I think what you're referring to was this great new initiative we had started last year, which we called Coverage Crews. So it was local volunteers that were familiar with their community, love their communities, want to get the word out about health coverage. So they were going out to different community institutions and small businesses and restaurants and building awareness, getting the word out, making sure people in the community have information about how important health coverage is. So it breaks our heart to not be able to be out there. They're really fun events. They feel great. It's like we're out there with, community workers and elected officials and others. So it's a ton of fun and it works really well because, it generates attention and people get excited about getting enrolled and finding out how easy it is to do. So we have our work cut out for us this year, trying to find other ways to do it virtually. And our fingers are crossed that because we've done a lot of the kind of foundational work in Massachusetts has been at health reform and health coverage and, exchanges like the Health Connector for longer than any other state in the country. So we're hoping that a lot of that foundational work will continue to bear fruit for us, but we have to keep at it in all the ways that we can that are safe this year for this open enrollment period.
Now for those that's never done it, can you just explain to them how long the application process is, from when the time they apply and then the time they find out more or to find out if they're approved or not?
Yeah, so it depends if you apply for financial assistance or if you don't. But for most people, I really encourage people to find out if you qualify because way more people qualify than they may expect to. So it's worth doing that longer application to find out if you can get subsidies and extra assistance paying for your health coverage. I think it probably takes the average person maybe 40-45 minutes to do the whole application. But it is worth it, and it will tell you right away if you qualify. So that's sort of the benefit of the system and the way it's designed. It'll tell you if you qualify for Connector Care, if you qualify for Mass Health or state's Medicaid program, it'll send you right there, you'll enroll. So it's very automated, and so it's certainly worth just finding that time. And one of the things we always are mindful of during open enrollment is it's around the holidays. People are busy. There's a lot going on right now between COVID, the holidays, all kinds of things that pull people's attention away. But finding that, hour, if you can just block off and make sure you're taking the step to take care of your health, your family's health, your financial security, just have that peace of mind, get it done. And I should also say too, as people are thinking about when to find the time to do it, that our open enrollment runs through January 23rd, but the 23rd of each month is when you need to have made a payment, have selected a plan and made a payment for coverage to kick in the following month. Okay. So for a lot of people during open enrollment, they're signing up for coverage that will start January 1st. So we want people to make sure they've selected a plan, done their application, selected the specific plan they want to get into, and made a premium payment if they are going to end up owing a premium payment. Some people don't, by December 23rd. So that's a really important date for people to keep in mind. It's right around Christmas, so there's a lot going on, but that's why we encourage people to sign up early, get it done, and then they can have that peace of mind.
And more often than not, people are approved without any issues.
That's right. That's right. Sometimes people need to, submit a document to show where they live or something like that, but it's a pretty easy, straightforward process. Certainly worth doing. And we have supports for people who have questions. People can call our call center. They can reach out to their local navigator if they have any questions or run into any issues at all.
So, okay, and lastly, you touched on something earlier when you talked about the premiums, and with the layoffs, people's jobs will drop them, and then they'll be left without they'll be left without the insurance, and just a whole lot to take in. Just how sure you've heard people have told you stories about their situation, but just how frustrating is that to see that happen to so many people when they've been doing something for so long and they had it and now it's gone, and now they're not sure, they're worried that they can't do what they need to do to provide for their family as far as keeping them healthy.
Absolutely. It's so challenging for people, and it's heartbreaking. To lose one's job can be such a shock, and so disorienting and difficult for an individual and their family. And on our side of things, one of the things we try to think about is what's our contribution to trying to make that person's situation a little bit less challenging this year. And for us, that's thinking about the health coverage piece. For a lot of people, when they lose their job, and we know unfortunately so many people have this year as a result of the COVID pandemic here in Massachusetts and across the country, when people lose their job, a lot of them lose their health insurance along with that job. And so one of the things that an exchange like the Health Connector is really designed to do is make sure we can kind of catch those people and get them into health coverage so that they don't have a gap in health coverage, and to make it as easy for them as possible to find a plan that fits their needs, their family's needs. But one of the things we try to make sure people know about, again, is the financial assistance that's available for them to get into that coverage. If they've lost their job, they've probably lost a lot of their income too, even if they're on unemployment income. So it's extra important people check out, what's available to them in terms of financial assistance through the Health Connector. Our system helps make that easy for people to do. Some people, when they lose their job and lose their health coverage through their job, get offered something called COBRA. And that means that the person can now keep the coverage they had through their employer, but they're paying 100%, sometimes 102% of the total premium that their employer was probably covering most of.
Mm-hmm.
So it can be hugely expensive for people, $500, $600, $700, $800 a month just for individual coverage. Whereas at the Health Connector, again, as I said, most people are qualifying for very low cost premiums through our Connector Care program, particularly if they've lost income. So those plans can be between $0 a month, or for people kind of on the upper end of the income spectrum, it can be, $130 or so a month. But thinking about people who've gone through the terrible experience of losing their job this year, in Massachusetts, we want to make sure that health coverage and losing health coverage is not one of those things you have to worry about while you're going through that. So coming to the Health Connector's website, mahealthconnector.org, is the way we want to make sure people just check that box off. That is not one of the things you're going to need to worry about.
All right, awesome. All right, and you just told them where to go, but one more time, please tell them where to go and tell them the deadline.
Absolutely. So the Health Connector's website is mahealthconnector.org. People can come to that website, fill out an application, find out if they qualify for financial assistance to make that coverage extra affordable. Most people do. And right now we're in open enrollment. It runs through January 23rd. But people who want to start coverage that starts on the first of the year need to select a plan and make their payment by December 23rd. So get it done early. There's lots going on around the holidays and with everything going on in people's lives. So we want to make it easy. Get everybody to the website, get enrolled in coverage, and make sure you have your needs, your healthcare needs, and your financial security taken care of.
All right. Audrey, thank you so much for coming on and giving us this information. It's very important information. This is really appreciated, and the community definitely needs to hear this.
Great. Thank you so much for having me. I really appreciate it.
Not a problem. You guys have been watching the Lynn Lowdown. I'm your host, Mukala Kabongo. Have a great day.